Dear students, welcome back. In this session, we are going to discuss male external genital organs, part 1. So, these male genital organs are situated both outside the pelvic cavity and within the pelvic cavity. As lower temperature is required for spermatogenesis, the testes are placed outside the pelvic cavity in the scrotal sac. Since urethra serves both the functions of urination and ejaculation, there is only one tube enclosed in the urogenital triangle. Now, we will see the organs of this male external genital organs. So the male external genital organs includes penis, scrotum, testis, epididymis and spermatic cords. We have discussed about the spermatic cords earlier. Now we are going to discuss about the penis in this session. Okay, so the penis is the male copulatory organ and it consists of root and body. Okay, it consists of a root and the body. And the root of the penis is fixed. This part, so this is ventral view and this one is sagittal view. This is the root and this one is the body. Okay, so the root of the penis is called as fixed portion or attached portion, and this one is situated in the superficial perineal pouch. Okay, and the body or free portion. So this one is body or free portion of the penis. Okay, now we'll discuss about this root of penis and body of penis. So this root of penis consists of 3 masses of erectile tissue. The root of penis consists of 3 masses of erectile tissue. Whereas the body is also consists of 3 elongated masses of erectile tissue. So both root and body consists of 3 masses of erectile tissue. Okay, so I want to mention the names of these tissues and we will go in detail about it. Okay, in the root it is having 2 crura. One is left side and another one is right side and left side. That is called, in the singular form it is called as crus penis, and 1 bulb. So this one is bulb. So these are the 3 erectile masses. If you see in the body of the penis also will have 3 erectile masses in that. So on either side you'll have Corpus Cavernosum, and at the middle it is called as Corpus Spongiosum. So these are the 3 erectile masses. How they are going to connect with each other, now we are going to see. Okay, yes, coming to the root of the penis, and this is the fixed part and consists of 2 crura and 1 bulb. They are all erectile tissue and it is situated in the superficial perineal pouch. Now coming to the crus penis. This crus penis is an elongated cylindrical structure. This one is elongated cylindrical structure. Its posterior end is pointed. Here if you can see, this posterior end is pointed and it is attached to the bone in front of the ischial tuberosity. Only these pointed ends are attached to the bone in front of the ischial tuberosity, and the remaining crus is firmly attached to the margins of the pubic arch. and also it is covered by a muscle, perineal muscle called ischiocavernosus. Okay, and the superior surface is firmly adherent. So here this one is firmly adherent to the everted border of the conjoint, converges towards the follow of opposite side. So this one is going to converge with the opposite side like this. Okay, and sharply bends forward. If you can see here in the sagittal section, and this is going to bend sharply. Yes, sharply bends forward to become continuous with the corpus cavernosum. To become continuous with the corpus cavernosum. Okay, so cavernosum of the body of the penis. Okay, and the part of the urethra. So here another important thing, it's another important thing here is the next structure, that is called bulb. Okay, so if you can see this bulb, the bulb is attached to the perineal membrane in between the two crura. So the bulb is attached to the perineal membrane in between the two crura. So in between the two crura, the bulb is attached, and this bulb is covered by another perineal muscle called bulbospongiosus. Okay, and it is ovoid in form. This one is bulb is in ovoid in form. Okay, if you can see the attachments in detail, superiorly it is firmly adherent to the undersurface of the perineal membrane in the midline. Inferiorly it is covered by bulbospongiosus muscle. Anteriorly it bends forward. So here if you can see, anteriorly it bends forward to become continuous with the corpus spongiosum. So here this one is corpus spongiosum of the body of the penis. Okay, and its deep surface, if you can see the deep surface of this bulb is pierced by the urethra, which traverses its substance to reach the corpus spongiosum, which is located in the body of the penis. Okay, and this part of the urethra within the bulb, so the part of the urethra within the bulb shows a dilatation in its floor, which is called as intrabulbar fossa. So it is showing an what you called as a dilatation in its floor called as intrabulbar fossa. Okay, this is about the root of the penis. Now we will move on to the body of the penis. So here the body of the penis is the cylindrical. So this one, the body of the penis is cylindrical and pendulous flaccid organ measuring 7.5 centimeters to 10 centimeters in length. Okay, when erect, it becomes rigid. The length and girth almost get doubled. Okay, in the erect position, the surface which faces upwards and backwards is the dorsal surface. That means this surface forms the dorsal surface. It's very, very important. In erect position, keep it in mind, in erect position, the surface which faces upwards and backwards, just think if it is erected, so this becomes upward and backward, then the that surface becomes the dorsal surface, and the opposite surface and this surface becomes the ventral or urethral surface. Okay. Next, the body of the penis is composed of 3 elongated cylindrical structures, a pair of corpora cavernosum, so this one, so this is left and right corpus cavernosum, okay, and a corpus spongiosum, so this one, corpus spongiosum, which is made up of spongy erectile tissue with cavernous blood spaces in them. So that we can see in the transverse section. Okay. Now coming to the corpus cavernosa. This corpus cavernosa are 2 in number, placed side by side in the dorsal part. Okay. Dorsal part of the body of the penis consists of this corpus cavernosum, which is present side by side. Each corpus cavernosum has 2 fibrous coverings. So each corpus cavernosum will have 2 fibrous coverings, an outer and inner layer. So if you can see the transverse section, you can find out this thing. So this is the corpus cavernosum. So these two are the corpus cavernosum and this one is spongiosum. So these two are present on the dorsal aspect of the penis. Okay, and each corpus cavernosum has 2 fibrous coverings, an outer covering as well as the inner covering for this. The outer layer is made up of longitudinal fibers and forms a common covering for both. So if you can see, this forms the common covering for both the corpus cavernosum. Okay, so and which is made up of with longitudinal fibers, and the inner layer made of circular fibers is separate for each corpus cavernosum, and the inner layer is separate and which is separate for each corpus cavernosum. Since the corpora cavernosa lie side by side, the adjoining parts of the inner layers of the fibrous covering of the 2 corpora cavernosa come into contact with each other and form a septum called as septum pectiniform. So in between them it forms a septum like structure called as septum pectiniform. This septum can be considered to form a partition between the cavernous blood spaces of the 2 corpora. Okay, if you move on to the anterior end of the penis, so if you move on to this anterior end, then what happens? So the septum is incomplete. So if you move on to the anterior side, the septum is incomplete, being made of bands with gaps in between, through which the cavernous blood spaces of the 2 corpora cavernosa communicate freely with each other. Anteriorly, the 2 corpora end blindly under the cover of glans penis. So this is called glans penis. So this corpora cavernosa is going to end below this glans penis. Okay, next coming to the corpus spongiosum. This corpus spongiosum is a cylindrical structure placed mid-ventrally. So it is placing mid-ventrally in the groove between the 2 corpora cavernosa in the body of the penis. It conducts the spongy part of the urethra. If you can see here, so the deepest part of the bulb is having urethra, and this urethral tube is continued in the Corpus Spongiosum. Okay. Anteriorly, it enlarges into a conical cap. So, this one anteriorly, it enlarges into a conical cap, and then which is directed backwards and called as glans penis. So this one. So this is backwards. So and it is directed backwards. This is called as glans penis. Okay. So again we will see this corpus spongiosum. It is a cylindrical structure placed midventrally in the groove between two corpora cavernosa in the body of penis. It conducts the spongy part of urethra. Anteriorly, it enlarges into a conical gap directed backwards, and it is called as glans penis, which is the most sensitive part of the penis. At the ventral aspect of the apex of glans, so here, at the ventral aspect, at the apex of the glans, there is an sagittal slit of the external urethral opening. So this here it forms the external urethral opening. The base of the glans has a prominent projecting margin called as corona glandis, which overhangs the neck of penis. So this is about the corpus spongiosum, and this within the glans the urethra shows, so within the glans the urethra shows a dilatation in the roof called as navicular fossa, this dilatation. So throughout this urethra, if you can see the course of the urethra, you'll have two dilatations. So one is at the bulb, that is intrabulbar fossa, whereas another one in the glans penis, that is called as navicular fossa. Okay. So this is about the corpus spongiosum. Now we will see the coverings of the penis. So it consists of skin and fascia. The skin of the penis is thin, delicate, which is dark and devoid of hair follicles and loosely connected to the underlying fascia, so as to allow free movement of the skin over the organ. At the neck of the penis, it is folded upon itself to form a hood-like structure, which is called as Propuse. So this is the skin part. So this is the neck part. So this is the neck part, and this folded skin to form a hood-like structure for the glans is called as Propuse. Okay, the inner layer of the Propuse. So it is having outer layer and inner layer. The inner layer of the Propuse is continuous with the skin covering the glans at the neck of the penis, and a triangular median sagittal fold called frenulum stretches between the inner layer of Propuse and the under surface of the glans. So at this part, you can see at the under surface, you can find this fold. Okay. At the urethral opening, the inner layer is continuous with the urethral lining. Okay. So again we will see the inner layer of the Propuse is continuous with the skin covering the glans at the neck of the penis, and a triangular median sagittal fold called frenulum, so which stretches between the inner layer of Propuse and the under surface of the glans. So here you can find such kind of triangular median sagittal fold called as frenulum. Okay. And at the urethral opening, the inner layer is continuous with this urethral lining. Okay, and this propuse is a retractable fold of skin, and the space between it and the glands is called as propusial sac. So in between the space between the glands penis and this propuse is called as propusial sac. In the skin of the corona glandis or glans penis, there are numerous sebaceous glands called as propusial glands. They secrete the smegma, which collects as plaques in the propusial sac and emit a characteristic odor. Okay, so this is about this skin. And coming to the fascia, so this layer is rich in elastic fibers and may also contain muscle fibers called peripenic muscles. It covers the corpora cavernosa and corpus spongiosum. So both corpus cavernosum and spongiosum is covered by this fascia penis. This is also called as Buck's fascia. Okay, and this fascia intervenes between the deep dorsal vein and superficial dorsal vein of the penis. So those things we can see in the transverse section. So here, this is the superficial fascia. So actually I have mentioned that this penis doesn't have any deep fascia. The membranous layer of the superficial fascia is continued over this penis, isn't it? So in that also it is having a superficial layer and deep layer, and the deep layer is considered here it has deep fascia, but it is not actual deep fascia here. Okay, so this is the superficial fascia around the body of the penis. Okay, so if you can move on to this here, so the structures which are related, so here you can find this superficial dorsal vein of penis. Okay, anteriorly at the neck, it blends with the fibrous sheaths of the corpora cavernosa and corpus spongiosum. Posteriorly, it continues with the subcutaneous facial layer of the scrotum below and fuses with the suspensory ligament of penis above, which extends to it from the pubic symphysis. Okay, I have already mentioned this ligaments also. So one is the fundiform ligament and the suspensory ligament. The fundiform ligament is superficial to the suspensory ligament, and it is a thickened band in the deep membranous layer of superficial fascia of the anterior abdominal wall, stretching between the linea alba and the pubic symphysis. Okay, and these two ligaments are the supports of penis to hold it in that space. Okay, this is all about the penis structure, that is root of penis and body of the penis and coverings of the penis. Now we will move on to the blood supply. Next one is the blood supply. So blood supply for this penis is brought about by internal pudendal arteries as well as external pudendal arteries. So the internal pudendal arteries gives branches called as dorsal arteries of the penis. So this is the dorsal surface, this is the dorsal artery of the penis, and deep arteries of penis. Next one is the deep arteries. So this one is the deep arteries of the penis which are branched here, and arteries to the corpus spongiosum, and these three arteries or the branches of internal pudendal arteries which supplies the penis. Okay, and also superficial external pudendal artery, which is a branch of femoral artery. Keep it in mind. Superficial external pudendal artery, which is a branch of femoral artery, supplies the skin and fascia of the penis. Okay, this is about the arterial supply. Now coming to the venous drainage, deep dorsal vein. So this one is the deep dorsal vein. Enters the pelvis through the gap between the inferior pubic ligament and transverse perineal ligament to end in the prostate plexus of veins. And coming to the superficial dorsal vein, ends in the superficial external pudendal veins. Okay, this is about the blood supply regarding penis. And next, coming to the nerve supply. Here comes the nerve supply. Dorsal nerve of penis. So here you can find this is the dorsal nerve of penis, which is a branch of pudendal nerve, supplies the skin. So this is the pudendal nerve, supplies the skin, and also it is supplied by the parasympathetic fibers from S2, S3, S4 segments of the cord, reach through pelvic and prostate plexus. So they produce, the parasympathetic fibers produce vasodilation and erection. Okay, this is about the nerve supply. Coming to the lymphatic drainage, it consists of superficial set of lymphatics and also a deep set. So normally superficial, so this 1, 2, 3 and all or the superficial set, and the fourth one is the deep set of lymph nodes. Now we will see. So superficial set of lymphatics from the Propuse. Okay, from the Propuse. So this one is the Propuse here. From the Propuse runs backward on the dorsum of the penis. So dorsum of the penis. At the pubic symphysis, they split into two groups which end in the superficial inguinal nodes on two sides. So like this. So these are all the superficial inguinal lymph nodes. Okay, and coming to the deep set from the glands at the sides of the frenulum. That means frenulum is present this underside. So runs backward on the dorsolateral sides, of the penis to reach the deep inguinal nodes. These are the deep inguinal nodes. Okay, some pass through femoral and inguinal canal to reach the external iliac nodes. Okay, this is about the lymphatic drainage of the penis. Okay. Now we will see the applied anatomy of this penis. So one condition called as phimosis. The prepucial meatus may be very small or pinhole-like. So that means here this one is pinhole-like. The opening is, the slit is not present properly here. The individual experiences difficulty in passing urine as urine balloons the perpusal sac and comes out in thin stream. Okay, so what is happening in this such condition means, in phimosis, the retraction of the propuse, so that means the skin, the retraction of the propuse is difficult and difficulty is experienced during intercourse. So this is the normal penis which is having completely retracted skin, and here the skin is not retracted properly. Okay, and if with great difficulty the propuse is retracted, it may form a constricting ring around the neck of the penis, causing a painful swelling of the glands. Such condition is called as phimosis. Removal of Propuse. So for this, a small surgery has been done, that is a removal of the Propuse, that is called circumcision is done to treat the phimosis. Okay, and another condition called as the frenulum of the Propuse. So the frenulum, so which is present on the under surface, which is having an artery in it. Injury to the frenulum during intercourse can lead to the rupture of the artery and intractable bleeding. This is about the applied anatomy related to the penis. And a small a thing that is called as mechanism of erection we will see. So what happens during this erection? So during erection, the penis becomes more than double in length and circumference. Here you can see the length is doubled here, length and circumference, and it becomes rigid also. Its cross-sectional outline resembles triangular prism. Its cross-sectional outline resembles the triangular prism with rounded angles. So this one is with rounded angles like this. And the erection is purely a vascular phenomenon. Purely a vascular phenomenon. The deep arteries of the penis break up into curled helicine arteries. You can see here. So these are the deep arteries. If you can compare with this flaccid and erect penis, so it is almost dilated here. These arteries undergo dilation and pour more blood into the cavernous spaces of the corpora cavernosa. Okay, increased blood is also poured into the corpus spongiosum also. Okay, and the glands through their arteries. Next one is venous return from the penis is retarded due to the pressure of engorged, that means dilated corpora cavernosa, and also due to the contraction of ischiocavernosus. Okay, so the strong Tunica Albuginium. So I have told that this corpora cavernosa is covered by a fibrous sheath, isn't it? That fibrous sheath is called as Tunica albugina, and which greatly contributes to the stiffness of this engorged corpora. Okay, and the nerve which helps in erection is by the parasympathetic fibers, which controls the erection. Okay, this is all about the penis, and in the next session we are going to see the next part of the male genital organ, that is testis. Okay, thank you.